What is VA healthcare eligibility? If you're a veteran or know someone who is, you might be wondering what it takes to be eligible for VA healthcare benefits. Let's break it down to help you understand the process and requirements. To start, you need to have served in the active military and not have received a dishonorable discharge. If you enlisted after September 7, 1980, or entered active duty after October 16, 1981, you must have served 24 continuous months or the full period for which you were called to active duty. However, there are exceptions if you were discharged for a disability caused or worsened by your service, or if you were discharged for a hardship. For Reserve or National Guard members, you must have been called to federal active duty and completed the full period for which you were called. If you only had active duty status for training purposes, you don't qualify for VA healthcare. The VA uses priority groups to determine who can enroll in their healthcare program. These groups range from 1 to 8, with 1 being the highest priority. Your eligibility and income will determine which group you fall into, and some veterans may have to pay a copay for treatment. To apply, you'll need to gather some important documents. These include your Social Security number, military discharge papers like your DD-2 Fortin, and information about any insurance coverage you have, including Medicare or private insurance. You'll also need details about your gross household income and any deductible expenses from the previous year. Once you apply, the VA will verify your eligibility and assign you to a priority group. This group will determine the level of care and services you're eligible for. For example, all veterans receive coverage for most care and services, including treating illnesses and injuries, preventing future health problems, and improving your ability to function. VA healthcare covers a wide range of services, including preventive care like health exams and immunizations, inpatient hospital services like surgeries and medical treatments, and urgent and emergency care. You'll also have access to mental health services, assisted living and home health care, and prescriptions written or approved by a VA doctor. In some cases, you might be eligible for community care, which allows you to receive care from non-VA providers. This can happen if the VA cannot provide the service you need, if you live far from a VA medical facility, or if it's in your best medical interest to see a community provider. Remember, being enrolled in VA healthcare also meets your Affordable Care Act health coverage requirement, so you'll be covered on multiple fronts. To get started, you can apply by phone, online, or in person. The VA's toll-free hotline is available Monday through Friday to help you with your application. So, take the first step and see if you're eligible for the healthcare benefits you deserve.